1 second. So it's recording, so you can go ahead and start whenever.
Welcome to the January installment of the ALF Get Fit campaign. I'm here to present mindfulness and chronic disease. My name is Pranav Barman, and my mentor's name is Lisa Van Wagner. Our disclosures for this presentation are as follows. As you can see, the disclosures for Dr. Van Wagner and Dr. Barman. Our learning objectives for this webinar include defining mindfulness, discussing how mindfulness relates to general health, discussing how mindfulness relates to liver disease, and finally, we will provide some tips and strategies for incorporating mindfulness into daily life. First, we must define what mindfulness is exactly. It is something that we all naturally possess, an ability that's innate within us. It is broadly defined as a skill that can be used to observe emotions, sensations, and thoughts without judgment. Another way to think about this is the fact that there is not a right or wrong way to think or feel in a given moment. There are different descriptions and definitions that have been used to describe mindfulness over the years and in the literature. Some describe it as paying attention on purpose. Some describe it as a moment-to-moment awareness. And some describe it as bringing awareness to what one is directly experiencing. These concepts will become more clear as we move through this presentation. The overarching goals of mindfulness or practicing mindfulness are to allow us to tune into present sensations, to not be overly reactive or overwhelmed by what's going on around us, and to not rehash the past or imagine the future. The ultimate goal is to not focus on anything but the present state and think about how the present state makes you feel. It is also learned by many different methods, such as meditation exercises, yoga exercises, and education regarding psychoanalysis. And the other big benefit is that it can be cultivated in many situations and incorporated into daily activities such as cooking, eating, or even cleaning. Who should perform mindfulness? The basic answer to this question is anyone. No matter how old you are, what your profession is, or what your physical ability is, or what your religion is, you should be able to perform mindfulness. Remember, it is not an obscure or new to anyone, but rather something that we already have and just have to learn how to cultivate, which is admittedly the hard part of this. There have been many benefits on physical and psychological health that have been demonstrated regarding mindfulness. It has been shown to decrease stress and anxiety. It improves overall well-being. It has been shown to improve our immune system's ability to fight off illness. It can increase positive emotions and reduce negative emotions, and has also been shown to be as good as antidepressants in preventing depression and depression relapses. One of the more unique things that mindfulness can do is that it can change the way our brain is composed in terms of the types of cells that are in our brain. And it has been linked to increase in the regions for learning, memory, emotional regulation, and empathy. It can foster compassion and altruism, enhance relationships, and even fights obesity. A lot of these benefits have been translated into schools, prisons, hospitals, and other industries who have implemented mindfulness and the practice amongst their employees and have demonstrated some very positive benefits. There have been a few special populations that have been studied with respect to mindfulness. In pregnancy, it reduces anxiety, stress, and depression both during pregnancy and after pregnancy, reducing the impact and burden of postpartum blues. In students, it reduces behavior problems and aggressive behavior, and it also improves their levels of happiness and their attention span. In teachers, it has been shown to lead to less negative emotions and symptoms of depression and greater compassion and empathy, which result in improved relationships with their students and therefore improved teaching ability. Amongst prisoners, it can reduce anxiety, anger, hostility, and mood disturbances. The prisoners are thereby more aware of their thoughts, which help with their rehabilitation and reintegration after uh, being released. In war veterans, it's been demonstrated to reduce symptoms of PTSD. Amongst patients with chronic illness, mindfulness can improve mood, sleep, quality, fatigue, pain, stress levels, and overall quality of life. But more importantly, it brings a shift in attitude and perspective that allows one to see chronic disease through a different lens. And this is a lens that allows you to avoid fear and doesn't allow fear to drive your behavior, but rather to view chronic disease with a lens of hopefulness and positivity. In patients who underwent organ transplantation, as we will discuss, specifically, mindfulness was uh, shown to have significant positive impact. Mindfulness-based stress reduction is a formalized curriculum that we will discuss in a few slides, but in patients with chronic illnesses, this specific curriculum helped with coping strategies, overall well-being, overall quality of life, and improved mental and physical health behaviors and compliance with health plans and medication adherence, which then in turn improve their entire physical health profile. And finally, it helped with fewer and shorter hospitalizations. The chronic illnesses studied here included fibromyalgia and chronic pain syndrome, rheumatoid arthritis, diabetes, chronic fatigue syndrome, and cardiovascular disease. Importantly, while the MBSR curriculum only lasted for a few weeks, the long-term benefits were sustained out to 3 years, and virtually no side effects were noted. In patients with hepatitis C, which is a emerging infectious diagnosis that we will see over the next decade or so, positive changes were noted in immunological function, anxiety reduction, and the understanding of the disease in patients who underwent mindfulness training, as well as teaching mindfulness at an early diagnosis timeframe helped with medication adherence, thus resulting in improved cure rates. More specifically to our talk here is mindfulness-based stress reduction and liver transplantation. It reduced anxiety, depression, and poor sleep quality in patients who underwent solid organ transplantation. If you look at the graphs here, you can see that in the black dots reflect patients who underwent mindfulness-based stress reduction curriculum, and their values initially for all three of these parameters were higher than patients who did not undergo mindfulness-based stress reduction. But over time, as you can see on the bottom line, over a year, the effect of improved anxiety, depression, and sleep was sustained. This is in comparison to a health education program where patients were taught about anxiety, depression, and sleep, and instructed on how to avoid these issues from worsening their condition, but did not receive formal education on how to actually do that. One of the other benefits that was noted in this study was that mindfulness can counter some of the psychological side effects driven by a new medication regimen, which is very common after transplantation. In another study involving solid organ and bone marrow transplant recipients, mindfulness-based stress reduction was incorporated into the care of the recipients and the caregivers. First, and most importantly, the stress, depression, and anxiety levels all improved in patients, as well as this effect lasted out to at least 3 months, as studied in this paper. Additionally, patients reported more positive affect and less negative affect when discussing their disease. Quality of life, especially the mental component of quality of life, also improved, and resilience was improved amongst caregivers, suggesting that not only can patients with chronic disease benefit from this, but others can benefit from this, helping the overall disease profile. Another very important finding from this study was that mindfulness was easy to administer and easy to adhere to. So now we get to how do we perform mindfulness. There is actually a formal curriculum for mindfulness-based stress reduction. This is normally delivered in a structured group. We will go through some details on the next slide. If interested, the formal curriculum can be found at this website. The formal curriculum is generally delivered in a structured group. It consists of 8 weekly sessions that last about 2.5 to 3 hours each. There is an all-day silent retreat held on one of the weekend days during week 6. And the exercises include mindful body scanning, which is essentially focusing your attention from your head to your toes and being aware of the senses in all of your body. Sitting meditation, walking meditation, and hatha yoga postures. These exercises are taught within these weekly sessions, and participants are expected to practice these exercises daily for approximately 20 to 45 minutes. It is considered a very experiential and highly participatory group format. And the goal is to use an array of mindful practices that will meet the needs of all students. It is definitely a formal process that requires commitment and self-engagement from all those involved, including the teachers. Now we understand that this is difficult to perhaps do on a daily and weekly basis. And so we'll present to you some informal practices that can be easily incorporated into our daily lives. Generally, these practices are meant to give you strategies for incorporating this while you're living your daily life. It involves paying attention to the world around you, thinking about meanings of words and their uniqueness in your world. Consider finding details on objects that have not been noticed before. A major focus on breathing and paying close attention to your body and senses. You don't need any special equipment except for some space and time. The goal is to pay attention to the current moment, not the future and not the past. Perhaps the most difficult part, but the most important part, is to let judgments and thoughts roll by instead of focusing on what they may mean or what they may affect. And if your mind does get carried away, focusing on these judgments or thoughts, then focus on returning to the present moment. The best way to get better and reap the most benefits is by practicing on a daily basis. We will now discuss a few specific techniques to practice mindfulness in your own home. The first one is seated meditation. We start by sitting comfortably, noticing that where your legs are positioned, you want to straighten your upper body and position your arms naturally in your lap or at your side. Drop your chin and gaze downwards. And when you notice your mind wandering, no problem. Gently return your attention to your breath, which is the anchor to the moment in which you are in. The focus on the breath is not because there's anything special about it, but it is the physical sensation of breathing that is always present and can always anchor you to the fact that where you are in the present, sitting and focusing on that breath. Practice observing your wandering thoughts without reacting to them. Again, it is okay that your thoughts may wander. The key to this is not letting yourself get trapped in those thoughts and wondering what they may mean. When you are done, notice your thoughts and emotions as you lift your gaze and observe your surroundings. Overall, just sit and pay attention. Come back to your breath over and over again without judgment or expectation. There are 2 websites listed here that can help you practice seated meditation. These are step-by-step guides for a 3-minute and 5-minute meditation session that can be used. The next strategy is what we call walking meditation. You want to stand up straight with your back upright and your weight evenly distributed. You want to curl your thumb of your left hand in and wrap your fingers around it, and then wrap your right hand around your left hand, as shown in the picture. Drop your gaze slightly. The goal here is this will help you maintain focus by not being distracted by your surroundings. And start with your left foot. Feel it swing. Feel the heel hit the ground. Feel the ball hit the ground, and then the toes. Do the same with the right foot. Walk at a steady pace, slightly slower than daily life, but not very slow. When your attention wanders, bring it back to the sensations of your feet touching the ground. Here, the sensations of your feet touching the ground is what anchors you to the present moment, which is in parallel to the breath in the seated meditation exercise. Another strategy is to practice mindfulness before we go to bed. The goal here is to not lose awareness of the present moment. An example of this is when someone is getting ready to go to bed and is worried about all that they have not accomplished today and how they will then accomplish all of this tomorrow. And in that setting, they then fall into a trap of maladaptive thoughts and cannot sleep, which then worsens their functionality tomorrow. The first thing you want to do is dim the lights about 1 hour before bedtime, which will help wind the brain down and wind the body down. This also can involve engaging in relaxing activities outside the bedroom that pass time quietly. You want to avoid looking at anything with a screen, so put away your tablet, phone, computer, TV for the night. The light can keep you awake and alert and doesn't allow you to focus. 10 minutes before bedtime, begin a focused mindfulness exercise. An example would be to sit in a comfortable chair in a dimly lit room and perform a body scan. You start with your head, touching the back of the chair, and feel its sensation as you move your way from your head to your toe. This mindfulness exercise should take about 5 minutes, and if you notice that your mind has wandered, then you can get it back on track. Remember that it is okay that it wandered, but what you don't want to happen is to sit there and wonder why it wandered, or get overwhelmed that it wandered. Try to avoid judging yourself while you do this, and the skill here lies in getting your mind back on track as opposed to continuing to let your mind wander. Finally, get in bed and focus on your breath. Again, remember the breath is an anchor to the present moment. If you are unable to fall asleep, perform your mindfulness exercise again and try not to get back into bed until you're sleepy. But remember, do not fall asleep in that chair. To review our learning objectives, we wanted to define mindfulness, discuss how mindfulness relates to general health, discuss how to liver disease, and provide tips and strategies for incorporating mindfulness into your daily life. Remember that mindfulness is an awareness of the present moment without passing judgment on its meaning. It's a skill that we all naturally possess, but have to cultivate for our own benefit. And remember that anyone of any religion, age, disease, illness can benefit from mindfulness. Mindfulness has been demonstrated to decrease stress, anxiety, negative emotions, and PTSD. It can boost the immune system, positive emotions, compassion, empathy, and quality of life, and it can even fight obesity. With respect to liver disease and chronic disease, of which liver disease is an example, mindfulness has been shown to improve mood, sleep quality, fatigue, and psychological distress, as well as overall quality of life. And it can bring about a shift in attitude towards one that is more hopeful and positive, as opposed to negative and downtrodden. With this shift in attitude, it's been demonstrated to improve health behaviors, medication compliance, reducing hospital visits, both the frequency and the length of hospital visits, all of which lead to better long-term outcomes. Specifically in liver transplant patients, we've seen similar benefits in the improvement in fatigue, anxiety, depression, and quality of life. And finally, we've provided some tips to pay attention to the world around you, such as seated meditation, walking meditation, and winding down before sleeping. The goal here is to take a break. It's okay to press pause in your life. This allows you to be a more efficient, compassionate, empathetic, and comprehensive person when you press play again on your life. If there are any questions, please don't hesitate to email or reach out to us.